Hello, everyone. We are so lucky to have Etty with us today, who's also a therapist. Today, we're going to be talking about very important information that unfortunately is not talked a lot about in many different types of communities. It doesn't matter where you live, what you do for a living, what community you live in. What we're going to be talking about today is extremely important for all of us to be informed because we don't know who may be struggling with this next to us or even in our family. So today, Etty's going to talk and share with us all we need to know about the basics of eating disorder. So, Etty, welcome. And it's very nice to have you today. Thanks for taking the time to share with us and talk a little bit about eating disorders because not many people know the specifics of what an eating disorder is. So tell us, what is an eating disorder?
Yeah, I mean, first off, thanks for having
Of
me.
course.
So the question, what is an eating disorder, is actually a pretty complicated question
Hmm.
because the DSM actually breaks it up into like 9 different categories, which
Wow.
people don't realize.
Uh huh.
So
And
I'm
the
gonna,
DSM is a book with all the mental diagnoses, and today we're going to be talking about some of them.
yeah, so I'm gonna just talk about like the main ones,
Uh-huh.
but just to be aware, there are other ones that include like ARFID, which is like, very selective about they only have certain foods that they eat, but it's not
Hmm.
really connected to food or weight.
Hmm.
Some, like diabulimia, which is specifically for diabetics who are
Hmm.
using insulin
Hmm.
to um, lose weight.
Hmm.
There's just like all sorts
Wow.
of just different ones that the DSM goes further into.
Hmm.
But then, kind of the main three eating disorders that you kind of see the most would
Hmm.
be first binge eating disorder,
Hmm.
which is, compulsive eating a lot of food in a short amount of time.
Hmm.
And I think with binge eating disorder, I think it's just important to kind of note that you do not have to be overweight. We see plenty
Wow.
of people who are actually pretty thin
Hmm.
and still struggle with binge
Hmm.
eating disorder. Ask me how that works. I can't really
Hmm.
tell you,
Hmm.
but we do see it.
So one may think, why is that a problem? If they're thin and they look healthy, let them do whatever they want.
Yeah, I mean, I think that there's health consequences,
Hmm.
right? As well as to just feeling horrible about themselves and the
Hmm.
guilt and the shame.
Hmm. The
And
emotional part of it.
yeah, the emotional
Wow.
piece. I
Okay.
think that's when we talk about eating disorders more than anything, it's
Hmm.
an emotional disorder.
Hmm.
Although it can display, has health consequences, all of that stuff,
Hmm.
it is a mental disorder. It is an
Wow.
emotional disorder that has severe
Yeah.
consequences
I
to
don't
those
think
struggling with it.
I think many people don't take this seriously that it is a mental disorder, whether it's binge eating or other areas of eating disorders, which you're going to talk about more. Is that this is a very serious thing, and it's not a joke. It's not something to take very lightly. So, what are some other areas of eating disorders?
Yeah, so then the other two kind of main categories are anorexia nervosa, which is, restrictive eating habits.
Mm-hmm.
People who don't eat a lot of food are obsessive about their body or their
Mm-hmm.
weight, that sort of thing. And then the third category is bulimia,
Mm-hmm.
those who um, remove food either by making themselves throw up or by
Wow.
exercising, which people don't
Wow.
realize as well,
Mm-hmm.
that exercise can be, someone who eats and overly
Mm-hmm.
exercises can be
Like an
still bulimic.
excessive
Yeah,
excessive exercising. Yeah.
exactly.
Sorry. So I think what we're going to be talking about today is it's all about balance. We want to kind of find that middle ground where we can encourage our children and family members and the people even that we live with, even for ourselves, to kind of find that middle ground to be healthy. So about we talked about the eating disorders. What in your profession, in your practice, what are some common ones that you see pretty frequently?
Yeah, I mean, I think it's interesting, right? I think in America, the number one eating disorder is binge eating
Wow.
disorder.
Hmm.
I think as far as a clinician,
Hmm.
and insurance reasons, as far as like insurance being able to pay for things, it's a lot harder for people to kind
Hmm.
of get help for binge eating disorder than it is for anorexia and
Hmm.
bulimia.
Hmm.
And because of that, as like an eating disorder clinician, we don't see it. We do see it, but just not
Hmm.
as much. There has to be, certain health consequences or certain things kind of in place for a
Hmm.
person to kind of get that sort of help.
So what would help look like for, let's say, binge eating disorder?
Yeah, I mean, I think the basis for binge eating disorder is really being on like a meal plan.
Hmm.
And so it kind of just really like tells you what a normal amount of food is and being able to give yourself the right amount of food
Hmm.
so that you can feel good and like trust that you know that you're having the right amount of food while
Hmm.
having like not having to like worry about like is it too much, is it too little, all those kinds of things.
Hmm.
And then also too dealing with like the emotional piece,
Hmm.
right? Like um, dealing with emotions
Yeah.
and all the stuff that
The
kind of comes up.
stressors. And
Yeah.
so I don't think many know that not all therapists can treat this specific disorder, because you have to be trained in it and also work together with, for example, a dietitian, a team of people, a doctor, to make sure that the person is safe. So for any parents that are watching right now, what is a message that you want every parent to know, that has kids?
Yeah, I mean, I think there's like a few things that kind of come to mind. The first is that like eating disorders are not generally what people think they are,
Hmm.
and it can display very differently for different people. And so, what I mean by that is that um, the one of the most common uh, eating disorders that I would say I see in my practice is actually atypical anorexia,
Hmm.
which is basically all the same things that anorexia has, except they're not at a low enough weight to be
Mm.
categorized as anorexic, and
Hmm.
yet the health consequences and the mental consequences can be
Hmm.
severe.
Yeah.
So I think just like realizing that it doesn't have to display in like that super tiny person who hardly eats anything.
Hmm.
Anorexics can still eat, but it's just I guess the focus of what's kind of the disorder is
Hmm.
like an inability or a disruption of daily function because they're so
Hmm.
obsessed
Hmm.
with these kinds of things.
So what should parents, like, what signs should parents look for when dealing with their children?
Yeah, I mean, I think looking for, are they, I think the biggest sign for me that I see is like if you're cutting out any food group.
Mm.
Um, your body needs every food group, whether
Hmm.
that's carbs, proteins, fats, vegetables, dairy. Your body needs all the dairy and vegetables are a little bit less,
Hmm.
but definitely carbs, proteins, and fats. Your
Hmm.
body needs all three of them
Hmm.
in order to be healthy. And so I think that's like to me what I see as like the biggest red
Yeah.
flag. But I
I
would,
notice when sometimes when I'm sorry, I don't want to cut you off.
yeah.
I notice sometimes when working with people, with clients, they sometimes with children, when I work with children, a lot of their thought process comes from their parents, because they see their parents obsessing over the way they look. Now they're taking on those characteristics, and it affects their growth and affects their thought process. So, what are your thoughts about that?
Yeah, 100%. I mean, I think a lot of, I do work a lot with adolescents, I would say. So I think, we definitely see a lot with, how that kind of affects them. I
Hmm.
think people don't realize, right, like the small comments that can kind of cause damage.
Hmm.
But I just think like few clients coming to mind, right, like parents standing in front of the mirror. That's like the classic
Hmm.
example. Making comments about their own body, about the
Hmm.
person's body, kind of telling the person that they need to be on a diet. All those things, like the way you talk about health, the way you talk about your body,
Hmm.
they really have an impact on your kids.
What are your
And
thoughts about diets? I know it's a huge thing in our culture. What are your thoughts about it?
yeah, I mean, I think as like a clinician in the eating disorder world, I think I'm very anti diets. Not that I'm
Hmm.
anti health, which I
Hmm.
think is like a big, for me, like the
Hmm.
big
Hmm.
differentiation, right? So, like, I'm all pro, eating healthy and
Hmm.
exercising, but not from the sense of calories or weight, but more of, this is what's healthy for our body and this is what's good for our body. And we
Hmm.
want to encourage ourselves and we want to encourage each other
Hmm.
and our kids to, to do that.
Yeah.
And that should be the primary focus as
I
opposed
know.
to,
I know. Now there's like this big, a lot of talk about intuitive eating. I'm sure you guys heard of it. If not, let's hear some information about that.
yeah. So intuitive eating is basically referring to one's ability to listen to their own body
Mm.
as far as like hunger and fullness, which is great, I will say, for most people. I think if you don't have an eating disorder, um, I'm all for it. I
Mm-hmm.
think though, we hear it a lot with our eating disorder clients is like, but I'm eating intuitively. I'm listening to my body. And the problem with that is that those with eating disorders, their hunger and fullness
Mm.
cues are off. So they're
Wow.
not regulated. So
Mm-hmm.
that means that, they get full after 2 bites of food
Mm-hmm.
or whatever it is. That's not, you can't listen to your body because you first have to regulate your hunger
Mm-hmm.
cues by being on a meal plan and giving yourself substantial food.
Mm-hmm.
And then at that point, once you're a few months in and your team feels like you're ready for that, at that
Mm-hmm.
point, you can begin to
And
listen
you
to your
can
body.
regulate that.
Yeah.
Wow, yeah, that's a very very deep concept. How do you help people with, and even children with, body image issues?
Yeah. I mean, I think definitely talking about, where it comes from. I think
Mm.
like kind of those negative associations, definitely doing some general self esteem work.
Mm-hmm.
But I think for me, one of the biggest things I would say is like that, clients find helpful, or I have personally found helpful, um, is really two things. But the first one is, um, acceptance of like there are part of the human experience is that there's days that you're not going to feel good in your
Mm-hmm.
body, and that's okay, right? Like, it's okay. Today I just
Yeah.
feel gross.
Mm-hmm.
I wouldn't label it as fat
Mm-hmm.
or that using those kind of negative labels, but I
Mm-hmm.
just don't feel good in my body
Mm-hmm.
today. And that's okay. That's part of the human experience.
Mm-hmm.
And the other thing too, I think, is like really trying to pay attention to um, be on the lookout for people that you think are beautiful or beautiful traits that aren't necessarily associated with being thin, right? Like
Mm-hmm.
we all know those people who are like, wow, you're just so pretty, right? And they're
Mm-hmm.
not necessarily super thin.
Mm-hmm. Mm-hmm.
So I think like kind of training
Mm-hmm.
your thought. There is also a lot of like mirror work that can be done, as
What do you
well
mean
as,
by mirror work?
yeah. So you like stand in front of a mirror, and there's like a few different methods, but you
Mm-hmm.
can like talk about each body part and
Mm-hmm.
why it's helpful, and then also like compare it to people in your family.
Mm-hmm.
It's a little bit of like a complicated
Wow, this
process.
is this is a very deep concept, and relearning how to love and accept yourself for how you are. I know there's a lot of concern for, for parents. Let's say they have a child who is overweight and they're concerned and they want them to be healthy. What are your thoughts about that?
Yeah, I mean, I think coming at it from, like I said, this kind of health for your body, for,
Mm-hmm.
but also not, if you have more than one kid, don't just focus it on,
Mm-hmm.
you're not just
Mm-hmm.
healthy
Mm-hmm.
because you're skinny. It doesn't work that way,
Very interesting. Right.
right? So, like, as a family, we're going to focus on health. We're going to focus on doing things that feel
Mm-hmm.
good for our body. And that includes, there are, leaner proteins, healthier fats, more
Yeah.
refined carbs, right?
Mm-hmm.
All those things that, are part of health, but just focusing it on it from the sense of
Mm-hmm.
like doing it for our body because it's a mitzvah to take care of
Yeah.
our body, and
100%.
that kind of healthful
So
approach.
through your experience, and I know Etty works in a center where she really has some difficult cases, and we want to be able to share to the parents that are watching this. What are some mistakes you've noticed? Parents missing, and the mistakes that parents unfortunately keep making. What message can you say for them, for these mistakes, to bring it to their awareness, of course, so they can stop and this cycle doesn't continue?
Yeah, I mean, I think the first thing that kind of comes to mind is like it's not about you.
Mm.
I think a lot of like, our parents kind of get so defensive, like, is this my fault? And they just don't
Wow.
want to, I didn't do that. I'm not the cause of it.
Mm-hmm.
This
Mm-hmm.
can't be. Just kind of like
Mm-hmm.
denial and kind
Mm-hmm.
of fighting it. That they're not really seeing, this was your child's experience. Whether
Mm-hmm.
or not that was yours, this was
Mm-hmm.
your child's experience. And you have to respect that.
Yeah.
And, try to
Mm-hmm.
work on yourself. There's always things that you can change.
Yeah.
Not every, no one's perfect.
Yeah.
And I think, there's always room to kind of just focusing on that
Mm-hmm.
piece of it. And two, the second part is also like, being aware of how much you can like force someone, because there is like a limited ability.
What do you mean by force?
So I think a lot of some of the tactics that we kind of see with parents, is this kind of like, I'll give you an example. Is I have a client right now who came in and told me that her mom told her that if she doesn't eat, then she's not going to eat either.
Ooh, like scaring her, like
Scare
threatening her.
tactics,
Wow,
exactly,
wow,
which is
wow.
like maybe it helps in the short term to like get her to eat a little bit, but it also causes all this
Hmm.
other stuff to
Yeah,
come up,
yeah.
and it's just not a very helpful
Hmm.
way for them to kind of overcome
Hmm.
that. I think also, listening to the
Hmm.
relying on the professionals who know what they're doing,
100%.
and then use your brain. Sometimes, professionals, we're not,
Yeah, 100%.
uh,
And go with your gut. If
go.
something doesn't feel right, talk to your doctor, talk to a therapist, or even get a second opinion if something doesn't feel right for you. So at this point, if you're watching this video and you feel like you may have this challenge, or somebody in your family, or your child, or a sibling is going through this is a very serious thing, and you don't want to miss it, because if you do miss it, it can get worse. The reason why we wanted to make this video is because we wanted to bring awareness. We wanted to talk about this very important topic. Unfortunately, goes under the radar. A lot of the times parents are coming from a good place and they want to help their child. They love their child and they want their child to look a certain way and to fit in within their friends group, and they don't want them to to feel like they're any different, and therefore they sometimes make certain comments that destroy the child's self-esteem. And there are other ways to be able to help a child with health, and even the family, like you said, the whole family dynamic. Do things as a family and don't just point fingers and just make those comments, because it can really destroy a child's self-esteem, and then it continues into later on in life, and that's not what we want. So I really, really appreciate you taking the time to share this message. If somebody is having a hard time today, like what's your suggestion?
So there's a few different things that you can kind of do. One is that you can reach out to your primary care doctor,
Hmm.
and kind of get referrals from them.
Hmm.
The person does need to be assessed to see, do they have an eating disorder, and then after
Hmm.
that, what level of care, right? Because
Okay.
there's outpatient,
Hmm.
day programs, IOPs,
Hmm.
inpatient, right? There's all different levels, and depending on the
Severity,
symptoms.
yeah. Depending on the
So I think
severity,
that's like
it's
a big piece of it.
yeah.
I think you can also go online to, like the National Eating Disorder
Hmm.
Association. They have a website. You can kind of call and ask
Hmm.
questions, or reach out to really any treatment center that deals
Hmm.
specifically with eating
At what
disorders.
age should a parent start to become concerned? Like when can these signs come up?
I mean, I think it's really sad to say. The youngest child I've worked with is 10.
Wow.
But
Wow,
the
10 years old.
youngest reported eating disorder is
Mhm.
actually 5.
5 years old. Oh my.
So yeah, I mean, I
What is a
think
5-year-old child like? What are some of the challenges for that 5-year-old child?
she, even with the 10-year-old, they're not
Hmm.
even fully aware
Mm.
of their emotions, of their thoughts. I
Hmm.
think it's becomes a little bit, it's almost like I would say in the younger ones, a little bit more similar to like OCD,
Hmm.
kind of, where it's
Hmm.
just like this compulsion, this
Hmm.
need to kind of, do this.
Hmm.
But it's like specific to eating behaviors and exercising
Yeah.
behaviors and that sort of stuff.
So when we're talking about eating disorders, are we talking specifically about body image, or the feeling of the sensory part of it, like how actually food makes them feel in their mouth? Let's say if we're talking about kids on the spectrum, and in that case, then obviously you would be working with a speech therapist. But here we're talking about mainly when people feel uncomfortable with the way they look and feel like they need to be a certain way. Correct?
Correct.
Yeah. All right, guys. So if you have any questions, feel free to leave us a comment, send us a message, and we will absolutely respond. So thank you so much, and thank you.